Hello and welcome to the Natural Health Network. We are a vetted directory of holistic providers, products, and services across the U.S. Today, we are here at Finish First Injury Prevention Specialists with Dr. Chase Banks. Thank you for having us.
Thank you. I appreciate it.
We're excited to have you on the network. And so I'll just jump right in. First of all, I've been a personal patient of Dr. Chase and your office for many years now, and can attest to the quality of their care and in all areas of life. Tell us a little bit about yourself and your background, education,
Okay.
How you got into chiropractic.
Okay. Well, I'm originally from Tennessee, and I went to the University of Tennessee at Chattanooga, and that's actually where I got my biology degree.
Okay.
I was pretty much pre-professional biology all the way through my 4 years of college, and at the last moment, actually, when I was decided I did not want to go to medical school. I've got too much of a perfectionist mindset and how I look at certain things, and so there was just some things in the OR that I just knew that I wasn't going to be capable of handling and being able to drop work at work and be able to go home and not be able to have to deal with things that happen just by happen chance, with surgical injuries or just how a patient responds to anesthesia. So I was like, I knew I wanted to do something in healthcare, but I didn't really have a clue what I wanted to do. And so I kind of started to go to my own personal experiences. And so I went back and talked to my chiropractor, and I thought all chiropractors practiced the same way, because he was the only one that I saw. And so I sat down with him, discussed a little bit about what the philosophy of how I wanted to practice, kind of similar to what he did. And he said, wait a minute, I just want you to make sure that you look at the right schools. And so I didn't really have an idea that there were so many different curriculums out there to do through chiropractic. And of course, all of them are doctorate programs. So he really wanted me to kind of steer closer to Texas Chiropractic College, because that's where he went, which is actually in South Houston, or National, which is in Chicago. And so me from Tennessee, that was a pretty easy option. So I chose TCC, that's Texas Chiropractic College. And so there I knew as I got into school, I wanted to focus also a lot on the nutrition aspect of our patients. And so I had this desire to help people advocate for themselves through nutrition. And so I spent a lot of my time in the curriculum focusing on understanding and learning, looking at the new aspects of literature and things like that, and applying those to our patients. And then I also, too, while I was there, I actually had the fortunate opportunity while I was at TCC to be a part of Rice's athletic department. Spent some time there as a kind of sports chiropractic intern, working on all the athletes. And then after that, I actually spent about 6 months with the VA in Temple. And that was kind of like a residency program where I worked in the physiatry department, which is pain management. It's their physical medicine and rehab department. And so what that taught me was a lot about just the severeness of chronic pain. Okay. What people deal with, how they get there, looking at the medical history, obviously the imaging, and really the whole case of a patient's kind of diagnosis, and then deciding, okay, based upon what's worked for them, what hasn't worked for them, are they a candidate for chiropractic? And if they are, how do we set that treatment program or plan up? And then we reevaluate about every 2 weeks, decide if they're progressing correctly. And believe it or not, that kind of formed me into kind of how we practice here.
Okay.
And so it's a very different chiropractic office. A lot of people that come here will say that, because every single patient has a different reason why they walk through the door. So their treatment plan, their therapies that we use, the education that we talk to them with is different, and it's all on a case-by-case basis. And so that's the reason why we have so many providers here, is because we can only see so many people in a day. Like I myself, 12 to 15 is max a day. I know a lot of chiropractors that will see 30 to 60 a day. But what we do here is there's a lot more time invested, and that's the reason why we get the outcomes we get.
Yeah, because you're really, in my experience, you really sit down and
Mm-hmm.
listen to what is going on and get the full picture, everything from diet and exercise to
Right.
stress levels to all of the things. That's what I love so much about chiropractic and holistic care in general. What specialties do you offer here in the office?
So I spend most of my time here at Finish First on what I would consider the management of some pretty severe, uh, health cases that were basically they've gone out and they've tried 5, 6, 7 other things. They've seen a dozen or so providers. They're not getting the answers that they want, typically because they're going to a specialist that is only looking at one specific area because that's what they do every single day. And even though they have the breadth and the knowledge to look outside of those means, but they don't spend the time to sit there and do the didactics that it's required
Mm-hmm.
to figure that out. So I do a lot of the stuff on the functional side, whether it's nutrition or just overall trying to figure out exactly what body systems are involved and what's causing the symptoms that they're experiencing. So that's what I'm doing. Then we have two other chiropractors. We have one that specializes in postural restoration institute. So that's a way of basically utilizing the aspects of how the body breathes, what positions you put the pelvis in, all actively, meaning that you have complete control over how your body basically orients its biomechanics. A lot traditionally with chiropractors, it's adjust, 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 which
Mm-hmm.
is fine. The adjustment's great, but the adjustment's a passive therapy,
Okay.
just one of many therapies. So it's like I always say is like, hey, if you're a carpenter, you need a bunch of different tools. But if all you have is a hammer, everything looks like a nail.
Mm-hmm.
So you're going to mess up some things along the way.
Mm-hmm.
So that being said, is that Dr. Emily, she takes care of all of our postural restoration patients that are inclined to be using that therapy. Then we have Dr. Isaac, who does a lot of our additional myofascial work, sports therapies. He does dry needling. He has a specialty that has to do with biomechanics in the golf swing and the sport of golf itself. So we kind of work with each other to, okay, if we have a patient that's more centered towards this area, this area, this area, we kind of use each other's expertise to kind of manage those cases. We also have a corrective specialist, corrective exercise specialist. Her name is Alicia. Alicia takes care of a lot of our active care patients that need kind of more kind of guidance on their actual physical therapy.
Okay.
She does a fantastic job of that. She also does all of our programming for people's workouts. So if you're wanting a workout to be planned month after month, that's what she takes care of. She's a CSCS provider for that. And then we have Gina. Gina is our newbie provider. So a newbie is a direct current activation type of therapy. So different than alternating current, which alternating current probably people are used to is like TENS unit, interferential, that kind of stuff. That means that typically the stimulus of the contraction only goes from the muscle back to the machine. When we do direct current activation, it's actually taking the muscle activation and telling the central nervous system, meaning the brain, the peripheral nerves, the spinal cord, exactly what it's like to contract. So if we've got somebody that doesn't have good, what I call motor control, meaning their brain to tell their muscles exactly how to move or move effectively, this is a way that we can speed up the rehab process. Also, too, that machine still allows us to do lymphatics. We have dry. We have again a wonderful sauna here that we use also in combination with that. We can do foot baths with it. So it allows us to do a lot of different things that people might need. So we also have a lot of patients that come in to get that therapy that are compromised neurologically, whether or not it's a spinal cord injury, whether it's a brain injury, or just a genetic predisposition that doesn't allow the nervous system to function that well. So as you can see, we do have a lot of different specialties, a lot of different services that we offer, because there is no one size fits all. There's no therapy that's superior than others. So again, if we've got somebody that's tried already, they're coming in here, that's done 4 or 5 different things, or your more traditional things for their diagnosis, but still not getting the outcomes that they want, we implore these different therapy techniques and try to actually improve that outcome.
And then I know you also do cupping. We've
Hmm.
had several requests for people that do cupping, and you also build nutrition
Hmm.
plans, yes.
Yes.
And so everything from babies,
Hmm.
right, to athletes and just injuries and
Correct.
every age group can benefit. Do you have someone in mind that you would say is more susceptible to walk in the door?
Yeah. So our going back to what I said, our kind of, we have a lot of people that are coming to us because we run a 100% referral based program. I mean, this is actually I've been doing this for going on 16 years.
Mm-hmm.
This is actually our first registry.
Mm-hmm. Thank
So
you
that
for
can give
that.
you an idea exactly how much I respect you and what you have to offer. But we run 100% referral based practice here. So
Mm-hmm.
that's other patients referring. We have orthopedic surgeons that refer. We have neuros that refer. We have other internists that refer, nurse practitioners that refer. Because we are multifaceted, we work with a lot of providers out there, even other chiropractors that refer us patients that are a little more complex for what they're used to using or what they're used to seeing. So, kind of our ideal patient are those that, one, they're invested
Mm-hmm.
into their own health, meaning they want to advocate for their outcome. They want to learn, and so coming here, you're gonna get that education for that piece. Get all the tools that you need to basically take the power out of going and seeing a provider every single week, and hopefully getting the tools that you need to basically take it on your own and change that long-term outcome. But again, those patients that have already maybe been frustrated with whether they're doing their PT somewhere and they're not getting the response or getting the more advanced care that they need. For instance, a good explanation would be somebody who had shoulder surgery, but they're in a PT surrounding area or a PT environment where basically um, they may be in their late 30s, early 40s. They're a rotational athlete, or they're just an avid, somebody that works out, but they're in a PT clinic, and unfortunately, they're around shoulder replacements. Those are typically somebody that's going to be a little bit elderly and doing the exact same therapy that they're doing, and because that's we can advance someone a little bit quicker that has a little bit more fitness level to them or that kind of stuff. We can do that. So.
Okay. And so, what are some of your favorite outcomes that you've seen someone walk in the door with XYZ and walk out, after treatment
Okay.
for however long?
Uh, you know, because we have such a wide variety of patients, there's not any one specific patient that comes to mind, but I would say what I enjoy the most for what I do, because I do so much nutrition and like kind of natural ways to optimize hormone pathways,
Mm-hmm.
is that when I get a female who is, been labeled PCOS, who's already had a few miscarriages, already maybe been through fertility and gone through IVF, wasn't successful. And there obviously the impacts that makes on a marriage, the impacts that makes on the psychology of the patient,
Mm-hmm.
and the future of their overall well-being. So having them come in and us do a little bit more maybe detailed intake,
Mm-hmm.
looking at the history, looking at what was done, what wasn't done, changing a few things based upon our didactics and testing, and making their outcome better so that their body can reach what we would consider homeostasis. That's really the goal for everyone, right? And so, and then all of a sudden get an email or get a phone call after they've been with us for 3 or 4 months, and all of a sudden they're pregnant. And so, and then that little one sticks. And so that's probably the coolest thing, is to help someone walk through that part of life. Obviously, when you've got somebody that's an athlete or just your run of the mill individual that's got an injury that they've had chronically for a really long period of time, it's not allowed them to play whatever sport or hobby that they have. And then all of a sudden we change a few things and doing some myofascial work, whether it's cupping, Graston, active release therapy, obviously the adjustments, and doing some really corrective mechanics with their movements, and teach them a little bit about mobility and trigger point work. And then all of a sudden, we get a picture, and that they're able to either achieve something that they haven't thought they'd be able to, with a goal that they have for their personal fitness or their overall aesthetics, and make that outcome.
That's
Mhm.
fantastic. And then I know that you work with little ones as
Yes, we
well.
do.
And so maybe you have some great outcomes with
Mm-hmm.
little ones.
So we obviously see anywhere from babies. We see a lot of younger children that are in youth sports, especially our kids that are in that age range from about 11 to about 16. That's where we see the majority of most overuse injuries that develop the growth plate problems that we see, especially if we have a jumping sport, whether it be volleyball for girls. We see a lot for basketball for boys, but also too is when we got a little league pitcher that's also on a flag football team as a quarterback, and so he's throwing for his his club team, he's throwing for his little league team, and then also he's throwing for his 7-on-7 for his as a quarterback. And we'll see and try to help the parents understand the amount of force and load that goes into those growth plates as those tendons insert on them, and helping them manage some of that pain that typically puts them on the sidelines for about 6 to 10 weeks. And teaching the parents and teaching the child exactly what we need to do to allow them to play through those things. Supported as necessary, and it's everybody's happy.
Right. And so if someone is interested and feels like they might be a fit, what are first steps and what is the initial, consultation look like?
Our initial consultation is typically about an hour. So you can call the office at 832-813-8451, and Keely or Melanie we'll be happy to take down your information, and they'll get you actually some intake forms to fill out online. When you come, we do ask that you do come, if you're coming for a consultation that's chiropractic related, that you come in some loose clothing, because we do a lot of movement here. So it's, again, we try to get the active component as fast as possible. If you are coming for a nutrition appointment or a consultation on overall just functional medicine, or if it's just a 30-minute consultation to find out, hey, do I need blood work? What does that look like? And so we have several different types of initial appointments depending on what your needs are. And again, if you have questions about those, Keely and Melanie can answer those. But just if you do come as a chiropractic patient, come in some loose clothing. If you do come as a functional nutrition patient, please bring us or come with any blood work, any testing that you've had done in the last 2 to 3 years. We'd like to see all that. And if you've had any other appointments, kind of a timeline of what's been done, what hasn't been done, what was discussed, what hasn't been discussed. Again, we'll go over all of these in that initial appointment, but if we have all that ahead of time, it gives us more time to discuss in detail that kind of history. So really it just depends. So it just depends on what you need.
Okay. Well, and all of their information now is listed on naturalhealthnetwork.org. You just go to the directory tab and scroll down to finish first. You'll see this logo and just get more information, and feel free to give them a call. Thank you so much for having us.
Thank you.
It was really awesome to learn more about your practice. And they are located in the Woodlands, Texas, but you also offer, I'm sure, for your nutrition needs, you can also do telemed from.
Yeah, we do Zoom with a lot of our patients. We have lots of patients that are outside of Texas. We have some that are from here, but yet they work in different countries. So we don't have a problem doing that at all. So again, I would prefer if you could come in, especially on the initial. I truly believe that there's some frequency improvements and energy improvements being one-on-one. Just can't get that through anything virtually, unfortunately. So, but I do feel that the outcomes are better when I'm able to meet one-on-one with someone.
Yes.
So.
All right. Well, like I said, head on over to naturalhealthnetwork.org for more information, and check us out on social media as well. We share all of our providers there, and you can check out all of their resources and social media as well. Thanks so much for joining us. If you have any questions or are looking for a provider, product, or service that is on the more holistic end to support your natural lifestyle, let us know. Thanks so much.